Communication in nursing. Communication is the means to establish a helping healing relationships. All behavior communication influences behavior. Communication is essential to the nurse-patient. Is the vehicle for establishing a therapeutic relationship. It the means by which an individual influences the behavior of another, which leads to the successful outcome of nursing intervention. Basic elements of the communication process. Sender is the person who encodes and delivers the message. Messages is the content of the communication. It may contain verbal, nonverbal, and symbolic language. Receiver is the person who receives the decodes the message. Feedback is the message returned by the receiver. It indicates whether the meaning of the sender's message was understood. Modes of communication. Verbal communication, use of spoken or written words. Nonverbal communication, use of gesture, facial expression, posture/gait, body movements, physical appearance, and body language. Communication is a human, interactive process that sends some meaning, information, message, emotions, or beliefs from one human being to another person or to a group of people. Connectedness and interrelationships between and among human beings occur because communication occurs. There are several forms of communication. Communication can occur with the spoken word, with the written word, and with body language and gestures, which are oral communication, written communication, and nonverbal communication, respectively. It is essential that the components of all types of communication are effective in order for the communication to occur and be effective. The sender of the message must be able to formulate and then express the message, and the receiver of the message must be able to process the message and then effectively respond back to the message. The expressions of the message and the responding to the message can be done orally, in writing, and with body language cues like shaking one's head up and down for yes and side to side for no, for example. The sender transmits and conveys the message to others. The receiver is the person who gets the message from the sender. The message is the information or emotion that is being conveyed or sent to another, and the feedback is the response of the receiver to the message. Characteristics of good communication. Simplicity includes uses of commonly understood, brevity and completeness. Clarity involves saying what is meant. The nurse should also need to speak slowly and enunciate words well. Timing and relevance requires choice of appropriate time and considerations of the client's interest and concerns. Ask one question at a time and wait for an answer before making another comment. Adaptability involves adjustments on what the nurse says and how it is said depending on the moods and behavior of the client. Credibility means worthiness of belief. To become credible, the nurse requires adequate knowledge about the topic being discussed. The nurse should be able to provide accurate information, to convey confidence and certainty in what she says. Communicating with clients who have special needs. Clients who cannot speak clearly, aphasia, dysarthria, muteness. Listen attentively, be patient, and do not interrupt. Ask simple questions that require yes and no answers. Allow time for understanding and response. Use visual cues, example words, pictures, and objects. Allow only one person to speak at a time. Do not shout or speak too loudly. Use communication aid. Pad and felt-tipped pen, magic slate, pictures denoting basic needs, call bells, or alarm. Clients who are cognitively impaired. Reduce environmental distractions while conversing. Get clients' attention prior to speaking. Use simple sentences and avoid long explanation. Ask one question at a time. Allow time for client to respond. Be an attentive listener. Include family and friends in conversations, especially in subjects known to client. Client who are unresponsive. Call client by name during interactions. Communicate both verbally and by touch. Speak to client as though he or she could hear. Explain all procedures and sensations. Provide orientation to person, place, and time. Avoid talking about client to others in his or her presence. Avoid saying things client should not hear. Communicating with hearing impaired client. Establish a method of communication, Pen/pencil and paper, sign language. Pay attention to clients' nonverbal cues. Decrease background noise such as television. Always face the client when speaking. It is also important to check the family as to how to communicate with the client. It may be necessary to contact the appropriate department resource person for this type of disability. Client who do not speak English. Speak to client in normal tone of voice. Shouting may be interpreted as anger. Establish a method for client to signal desire to communicate, call light or bell. Provide an interpreter translator as needed. Avoid using family members, especially children, as interpreters. Develop communication board, pictures, or cards. Have dictionary, English/Spanish, available if client can read. Many factors impact on and adversely affect communication. For example, nurses must overcome barriers to communication such as level of development and age. Infants can only communicate and send messages to others with behavioral cues such as crying and smiling. They are also not able to process messages from others unless they consist of message cues like cooing, a gentle touch, and a facial expression such as a smile. Young children, like toddlers and preschool children, typically have a limited vocabulary, so they are not able to understand verbal messages unless they are simple and at their level of understanding. They are also now able to receive and process nonverbal communication cues as well as to send messages with the same cues. For example, they will interpret the angry face of a parent as one that expresses the dissatisfaction of the parent in terms of their poor behavior. The nurse will assess the client's communication needs in respect to their specific age and developmental status and modify care accordingly to these age-related needs. Level of consciousness. Depending on the client's level of consciousness along the continuum, some clients are fully able to effectively formulate and send a message, process, and respond to the message. Others may be only able to send a message or receive a message effectively, and still more may not be able to do either. The nurse will also assess the client's communication needs in terms of their level of consciousness and, then, plan care accordingly. For example, the nurse may communicate with a non-responsive client with touch to communicate caring in the presence of the nurse, and they may use pictures to communicate messages to a client who is not able to receive and process verbal communication. Emotional state and level of stress. Communication can be greatly impaired when the client is adversely affected with stress and other emotional states such as anxiety, fear, distress, and confusion. For this reason, the nurse will attempt to alleviate these symptoms in order to be able to overcome this barrier to effective communication. Language spoken. As previously discussed, foreign language interpreters are often needed to facilitate communication with clients who communicate in a language other than English. American Sign Language interpreters may possibly be needed to effectively communicate with those who have a profound hearing deficit, and nurses and others may also need to utilize Braille reading materials for those affected with blindness. Nature of the relationships between and among people involved in the communication process. Communication can be impeded when the client views the healthcare professional as the one that is in the position of power and control rather than a person who is mutually exchanging a message with the client who is the center of care and the person who is actually in the position of power and decision-making, rather than the nurse or another healthcare professional. In order to eliminate this barrier, the nurse must establish trust with the patient. They must face the person when they are communicating with them, and at the same eye level of the patient in order to convey equality and mutuality rather than a position of power and authority over the client. Individual values, beliefs, perspectives, and perceptions. Individual values, perspectives, perceptions, and beliefs bias communication. At times people will only hear or see what they hear or see as based on their own, rather than an objective view and perspective. For example, a client may only hear the non-threatening rather than the threatening and stressful aspects of their plan of care because they are biased against the negative aspects of care. Similarly, gestures and other forms of body language are interpreted very differently as based on the client's preconceived notions, as well as their values, beliefs, perspectives, and perceptions. As a result of these factors, nurses must assess these individual values, beliefs, perspectives, and perceptions as they impact on the sending and receiving of messages. For example, the nurse will clarify and validate the client's nonverbal grimacing, which could be a sign of pain or it could be a sign of disgust during the interaction. Culture. Culture, in addition to many other things, also influences the person's use of terms and terminology as well as their perceptions of nonverbal messages. Some cultures view eye contact, touch, and proxemics in a manner that is not shared by the nurse and clients of different cultures. Some cultures view eye contact, touch, and close proximity as culturally acceptable and therapeutic, but other cultures may perceive and believe that eye contact, touch, and close proximity are offensive. Medical treatments. Some medical treatments, including sedation and intubation, for example, can be a barrier to effective communication. For example, an alert and oriented client who is intubated will not be able to send a verbal message, but they can interpret and process verbal messages sent to them. They may only be able to send written and nonverbal messages to others, and a sedated client may have limited communication abilities in terms of sending and receiving messages secondary to their altered level of awareness and consciousness secondary to the sedating medication, for example. Therapeutic relationship is a relationship that is established between a healthcare professional and a client for the purpose of assisting the client to solve his problems. Components of a therapeutic relationship. One of the most important skills of a nurse is developing the ability to establish a therapeutic relationship with clients. For interventions to be successful with clients in a psychiatric facility and in all nursing specialties, it is crucial to build a therapeutic relationship. Crucial components are involved in establishing a therapeutic nurse-patient relationship and the communication within it, which serves as the underpinning for treatment and success. It is essential for a nurse to know and understand these components as it explores the task that should be accomplished in a nurse-client relationship and the techniques that a nurse can utilize to do so. Trust. Without trust, a nurse-client relationship would not be established and interventions won't be successful. For a client to develop trust, the nurse should exhibit the following behaviors: friendliness, caring, interest, understanding, consistency, treating the client as human being, suggesting without telling, approachability, listening, keeping promises, providing schedules of activities, honesty, genuine interest. Another essential factor to build a therapeutic nurse-client relationship is showing a genuine interest to the client. For the nurse to do this, he or she should be open, honest, and display a congruent behavior. Congruence only occurs when the nurse's words matches with her actions. Empathy. For a nurse to be successful in dealing with clients, it is very essential that she empathize with the client. Empathy is the nurse's ability to perceive the meanings and feelings of the client and communicate that understanding to the client. It is simply being able to put oneself in the client's shoes. However, it does not require that the nurse should have the same or exact experiences as of the patient. Empathy has been shown to positively influence client outcomes. When the nurse develops and utilizes this ability, clients tend to feel much better about themselves and more understood. Some people confuse empathizing with sympathizing. To establish a good nurse-patient relationship, the nurse should use empathy, not sympathy. Sympathy is defined as the feelings of concern or compassion one shows for another. By sympathizing, the nurse projects his or her own concerns to the client, thus, inhibiting the client's expression of feelings. To better understand the difference between the two, let's take a look at the given example. Client's statement: I am so sad today. I just got the news that my father died yesterday. I should have been there, I feel so helpless. Nurse's sympathetic response: I know how depressing that situation is. My father also died a month ago, and until now I feel so sad every time I remember that incident. I know how bad that makes you feel. Nurse's empathetic response: I see you are sad. How can I help you? When the nurse expresses sympathy for the client, the nurse's feelings of sadness or even pity could influence the relationship and hinders the nurse's abilities to focus on the client's needs. The emphasis is shifted from the client's to the nurse's feelings, thereby hindering the nurse's ability to approach the client's needs in an objective manner. In dealing with clients, their interest should be the nurse's greatest concern. Thus, empathizing with them is the best technique, as it acknowledges the feelings of the client and at the same time it allows a client to talk and express his or her emotions. Here a bond can be established that serves as a foundation for the nurse-client relationship. Acceptance. Clients are unpredictable. There are times that they outburst with anger or act out their inappropriate desires. A nurse, who does not judge the client or person no matter what his or her behavior, is showing acceptance. Acceptance does not mean accepting all the inappropriate behavior but rather acceptance of the person as worthy. When the client displays an improper behavior, the nurse can communicate with the client by being firm and clear without anger or judgment. In this way, the nurse allows the client to feel intact but at the same time aware that his certain behavior is unacceptable. Let's take a look at the given example. Situation: a client tries to kiss the nurse. Inappropriate response: "What the hell are you doing? I'm leaving, maybe I'll see you tomorrow." Appropriate response: "Adam, do not kiss me. We are working on your relationship with your girlfriend and that does not require you to kiss me. Now let us continue." Positive regard. Positive regard is an unconditional and non-judgmental attitude where the nurse appreciates the client as a unique, worthwhile human being that shows respect for the client regardless of his or her behavior, background and lifestyle. The following ways are example of how to promote respect and positive regard to a client. Calling the client by name. Spending time with the client. Listening to the client. Responding to the client openly. Considering the client's ideas and preferences when planning care. Self-awareness. Self-awareness is the process of understanding one's own values, beliefs, thoughts, feelings, attitudes, motivations, prejudices, strengths and limitations. Before a nurse can understand clients, he or she should be able to understand him or herself. The first step in preparing oneself to build a therapeutic nurse-patient relationship is to understand oneself. Therapeutic use of self. A nurse can only use his or her personality, experiences, values, feelings, intelligence, needs, coping skills and perceptions to build a relationship with clients. Therapeutic use of self, when he or she has developed self-awareness and self-understanding.
Using therapeutic communication techniques to provide client support. Therapeutic communication techniques such as active listening, silence, focusing, using open-ended questions, clarification, exploring, paraphrasing, reflecting, restating, providing leads, summarizing, acknowledgement, and the offering of self, will be described below. Attentive, active listening. Active listening is an essential part of communication. Attentive listening is far more than hearing, and attentive listening is far more than simply remaining silent while listening to words. Active attentive listening is not a passive activity, it entails the nurse's hearing, processing and purposefully comprehending the client's words, as well as processing these words in the context of the client's situation and the nonverbal communication that is sent by the client as they are verbally expressing some message to the nurse. Silence. Similar to listening, silence is a purposeful active process rather than a passive process. Senders and receivers of the message take advantage of brief pauses of silence to think about and reflect on the full meaning of received message and to contemplate and reflect on how to respond to the sent message with feedback. Silence is a therapeutic communication technique that is also very helpful when the nurse wants to give the client ample time to fully and openly discuss their feelings, opinions, and beliefs. However, prolonged silence may be interpreted by the client as a lack of interest on the part of the nurse, so silence, in order to remain therapeutic, must be of an appropriate duration so that it does not adversely affect the client and the therapeutic nurse-client relationship. Focusing. Focusing with the client is a therapeutic communication technique used by nurses, and other members of the healthcare team, that facilitates the client's abilities to focus on and pay attention to the matters at hand, which should reflect the client's priorities. At times, some clients may use the nurse's presence to talk about things not even related to their healthcare and their healthcare problems. For example, they may want to chat about their extended family and their accomplishments at the same time that the nurse has to educate the client about their plan of care. Focusing on the subject at hand decreases the risk of having these kinds of distractions impair the therapeutic communication process. For example, the nurse may say, "Mr. Burke, your family is very interesting and successful. Thank you for sharing this information with me. Now, let's discuss your diabetes and the insulin that you will be taking after you leave the hospital." Using open-ended questions. Open-ended question, as previously discussed, elicits more and fuller information than a closed-ended question that requires more than a simple yes or no answer. This therapeutic communication technique is particularly useful when the nurse wants fuller and deeper information from the client and when the nurse is facilitating the client's full and free ventilation and expressions of their own feelings and beliefs. Closed-ended questions are also useful particularly when the client is not able to, for one reason or another, formulate more complete feedback and communication to the nurse. For example, closed-ended questions are useful when the client is cognitively impaired or they are on mechanical ventilation with intubation and not able to speak with the nurse and others. Clarification. Messages are often clarified and validated with clients in order for the nurse to ensure that the nurse has received and interpreted the complete and correct message without any errors, without any bias and without any false assumptions. Specific clarification techniques include exploring, paraphrasing, reflecting and restating, which will be discussed below. A possible question that the nurse may ask the client to clarify a message could be, "Am I correct that you told me that you plan on having home health care after your discharge, or you appear upset? Would you like to talk about it?" when the client appears upset with their nonverbal facial cues. Exploring. Exploring, in contrast to invasive and non-therapeutic probing, is using techniques that encourage the client to provide more details and information about a particular topic or healthcare problem. Paraphrasing. Paraphrasing, another technique that is used to clarify a client's message, is used by the nurse to rephrase a client's comment or question in a manner that is similar to what the nurse thinks that they have heard and understood. For example, a nurse may paraphrase a client's statement such as, "I am too tired to even think," with, "Did you mean that you are too tired now to continue with this education?" Restating. Restating is done to clarify the client's message by repeating the same statement back to the client. For example, when a client says, "I am ready to do some walking," and the nurse says, "Did I hear you say that you are now ready to do some walking?" Reflection. This therapeutic communication technique reflects and mirrors what the nurse believes the client's feelings to be underneath the words. It mirrors, or reflects, the patient's feelings, not words, back to the client so that the client's feelings can be further explored and expressed by the patient. For example, when a client appears to be angry and upset, the nurse may state, "You seem a little angry today. Would you like to talk about it?" Providing leads to the patient. Providing a lead to the client enables the client to continue discussing things with the nurse, and it also facilitates the client's beginning a new discussion that is focused on a particular thing. For example, the nurse may say, "Tell me about your concerns relating to your new medications." Hopefully, the client will take this lead and begin a discussion about their new medications and their concerns relating to them with the nurse. Summarizing. Summarizing is a highly useful therapeutic communication technique that sums up the primary and main points that were discussed as well as the conclusion of the discussion that was mutually decided up. For example, a nurse who is educating the client and family members about diabetes management and the interactions of diabetic medications, exercise, diet, and other factors may summarize this discussion with a summarizing statement such as, "During our discussion today, we have discussed the roles of diabetic medications, exercise, diet, and other factors as they interact with each other and how these interactions impact on the successful management of diabetes." Recognition, acknowledgement, and acceptance. Recognition, acknowledgement, and acceptance of the client and their thoughts which are conveyed during communication are therapeutic communication techniques and strategies that give the nurse the opportunity to let the client know that you are interested in them and respectful of them and their thoughts. It also allows the client to recognize that the nurse is open, honest, and without any bias or judgments. The nurse accepts the client regardless of their thoughts and words. Offering of self. The therapeutic communication process and the therapeutic nurse-client relationship must be based on the nurse's willing and unconditional offering of self and their time to the client and their needs, with only limited self-disclosure by the nurse that directly assists the client with meeting their needs. Barriers to therapeutic communication include challenging, probing, changing the subject, defensiveness, false reassurances, disagreeing, judgments, rejection and minimization, and stereotyping. Challenging. Challenging, simply defined in this context, is forcing the client to defend and justify their opinions, beliefs, and feelings. Challenging shows a lack of respect for the client and a lack of acceptance of the client as a unique being who has, and is entitled to, their own beliefs and opinions. The client has valid feelings that should never be challenged by the nurse. Probing. Probing is also not therapeutic. It is invasive, uncomfortable for most clients, and a threat to the client's right to privacy and confidentiality. Probing the client with questions that are not relevant to their healthcare and health-related concerns is never appropriate. It may satisfy the nurse's curiosity, but it is not at all helpful to the client and addressing the client's needs. Changing the subject. Like probing, changing the subject serves only the needs of the nurse and not the client, therefore, it too is not acceptable in nursing practice. People, including nurses, change the subject when they are too uncomfortable and uneasy about continuing the conversation. The conversation has become too stressful for the nurse. This is not an option. Nurses must identify their own feelings and cope with them before they enter into therapeutic conversations and relationships with clients. Defensiveness. Defensiveness occurs when the nurse feels the need to defend themselves, their actions, their employers or others for their failures and shortcomings. Again, this technique fulfills the needs of the nurse rather than the client and, as such, it is not therapeutic. False reassurances. False reassurances, like trite comments and giving clients everyday advice, are not at all therapeutic. False assurances and reassurances such as "don't worry, you are in good hands and everything will be fine" are examples of false reassurances that will certainly be a conversation stopper that will lead to client anxiety and the client's unwillingness to share their true thoughts and fears to the nurse in the future. These effects are detrimental to the client and their well-being as well as the therapeutic nurse-client interactions at the present time and also in the future. Disagreeing. Disagreeing with clients is also not therapeutic or acceptable. The nurse can attempt to correct misinformation in a therapeutic manner, but they should never disagree or argue with the client, their feelings and/or opinions. Judgments. Judgments place a positive or negative value on the client and their messages. The therapeutic nurse-client relationship must be, at all times, non-judgmental, open and honest. Rejection and minimization. Rejection of the client and any minimization and rejection of their expressions of feelings and thoughts are also not at all acceptable in the therapeutic nurse-client relationship. Stereotyping. Stereotyping is a barrier to effective communication and, in fact, it is a barrier to all thought and interpersonal relationships. Stereotyping involves generalized thoughts and words that are not at all based on the individuality and uniqueness of the individual. Non-therapeutic technique. 1. Overloading. Talking rapidly, changing subjects too often, and asking for more information than can be absorbed at one time. What's your name? I see you like sports. Where do you live? 2. Value judgments. Giving one's own opinion, evaluating, moralizing or implying one's values by using words such as nice, bad, right, wrong, should and ought. You shouldn't do that, it's wrong. 3. Incongruence. Sending verbal and nonverbal messages that contradict one another. The nurse tells the patient, "I'd like to spend time with you," and then walks away. 4. Underloading. Remaining silent and unresponsive, not picking up cues, and failing to give feedback. The patient asks the nurse, simply walks away. 5. False reassurance/agreement. Using cliché to reassure client. "It's going to be all right." 6. Invalidation. Ignoring or denying another's presence, thoughts, or feelings. Client, "How are you?" Nurse responds, "I can't talk now. I'm too busy." 7. Focusing on self. Responding in a way that focuses attention to the nurse instead of the client. "This sunshine is good for my roses. I have beautiful rose garden." 8. Changing the subject. Introducing new topic. Inappropriately, a pattern that may indicate anxiety. The client is crying, when the nurse asks, "How many children do you have?" 9. Giving advice. Telling the client what to do, giving opinions or making decisions for the client, implies client cannot handle his or her own life decisions and that the nurse is accepting responsibility. "If I were you," or "It would be better if you do it this way." 10. Internal validation. Making an assumption about the meaning of someone else's behavior that is not validated by the other person, jumping into conclusion. The nurse sees a suicidal client smiling and tells another nurse the patient is in good mood.
Non-therapeutic technique. 1. Overloading. Talking rapidly, changing subjects too often, and asking for more information than can be absorbed at one time. "What's your name? I see you like sports. Where do you live?" 2. Value judgments. Giving one's own opinion, evaluating, moralizing or implying one's values by using words such as nice, bad, right, wrong, should and ought. "You shouldn't do that, it's wrong." 3. Incongruence. Sending verbal and nonverbal messages that contradict one another. The nurse tells the patient, "I'd like to spend time with you," and then walks away. 4. Underloading. Remaining silent and unresponsive, not picking up cues, and failing to give feedback. The patient asks the nurse, simply walks away. 5. False reassurance/agreement. Using cliché to reassure client. "It's going to be all right." 6. Invalidation. Ignoring or denying another's presence, thoughts or feelings. Client, "How are you?" Nurse responds, "I can't talk now. I'm too busy." 7. Focusing on self. Responding in a way that focuses attention to the nurse instead of the client. "This sunshine is good for my roses. I have beautiful rose garden." 8. Changing the subject. Introducing new topic. Inappropriately, a pattern that may indicate anxiety. The client is crying, when the nurse asks, "How many children do you have?" 9. Giving advice. Telling the client what to do, giving opinions or making decisions for the client, implies client cannot handle his or her own life decisions and that the nurse is accepting responsibility. "If I were you," or "It would be better if you do it this way." 10. Internal validation. Making an assumption about the meaning of someone else's behavior that is not validated by the other person, jumping into conclusion. The nurse sees a suicidal client smiling and tells another nurse the patient is in good mood. Other ineffective behaviors and responses. Defending your doctor is very good. Requesting an explanation, "Why did you do that?" Reflecting, "You are not supposed to talk like that." Literal responses, "If you feel empty then you should eat more." Looking too busy. Appearing uncomfortable in silence. Being opinionated. Avoiding sensitive topics. Arguing and telling the client is wrong. Having a closed posture, crossing arms on chest. Making false promises, "I'll make sure to call you when you get home." Ignoring the patient, "I can't talk to you right now." Making sarcastic remarks. Laughing nervously. Showing disapproval, "You should not do those things." Thank you.